Hello, and welcome to Public Health Matters, a monthly program dedicated to discussing public health issues in our community. This program is sponsored by the Middle-Brook Regional Health Commission, which serves the towns of Bound Brook, Greenbrook, Middlesex, South Bound Brook, Wharton, and Watchung. My name is Colleen McKay Wharton, and I'm the health educator for the Commission and the host of the program. Our goal for Public Health Matters is to give you a program that will provide useful information to help you better understand important public health issues, and in particular, what you can do to reduce any risks associated with them. Tobacco use amongst adults and teens has certainly decreased over the years, and most likely due to a number of factors, including laws that further limit public smoking areas, as well as the increasing costs of cigarettes. And of course, in 2009, it's a pretty well recognized fact that tobacco products are harmful to our health. However, there are still those who continue to smoke. So joining us today are two public health partners who work to help individuals who are trying to quit smoking, as well as to prevent teens from even starting. Dr. Quitcenter is the program manager at the Tobacco Quitcenter at Somerset Medical Center, and Lauren Conley is with the Somerset Council on Alcoholism and Drug Dependency, and is the youth coordinator of a program called Rebel, which we'll be learning about today. So thank you both so much for joining us. Dr. Quitcenter, why don't we start with you? You know, as I mentioned, I think we all know that smoking is unhealthy, and no one goes into it thinking this is going to make me feel great, but yet people have such a difficult time quitting. Why is it so addictive? What is it that makes it so difficult for tobacco users?
It's really looked at as a chronic medical condition at this point, and also another way we look at it is a biopsychosocial addiction. Okay. So a lot of smokers that want to quit need to tackle all three of those elements.
Explain those three to us. When you say biopsychosocial, what exactly does that mean?
So a lot of people say it's an unhealthy habit. That often refers to the psychological part. Okay. The biological part, we often think of the nicotine withdrawal symptoms. Okay. And then the social part is most people start smoking in a group, and it's part of a sense of connection, a sense of belongingness, and something that a lot of people do in groups. So that all those dimensions need to be addressed.
Okay. Now, your work then with the Quitcenter, can you tell us about that, and does it work to actually address all of those areas?
We tackle each dimension at the Quitcenter with a specialized form of treatment. It combines specialty counseling, individual and group counseling, as well as using the 7 FDA-approved medications that help people quit.
Okay. Now, maybe we can tackle each of those individually. You talked about the biologic and the addictive aspects of it. What are some of the things that people are, experiencing? We hear people talk about when they quit, it's very, they're very jittery, or maybe, what are some of those symptoms?
Right, let's talk about the nicotine withdrawal symptoms. And that's one of the biggest barriers to quitting, is not understanding the nicotine withdrawal symptoms and not managing them. Okay. So, for example, someone who's relapsing in that first few weeks, the first 4 to 8 weeks of quitting, they're probably not understanding those symptoms and treating them. Okay. The typical example would be cravings. It might come in a thought, I need a cigarette, I want a cigarette, and these are kind of obsessional and make it hard to resist. And then a lot of people say, well, it's just a mental thing. Well, by mental, they might mean moodiness. I get really moody when I quit. Some people get sad or depressed. Some people get irritable or anxious. Okay. And there's other symptoms like concentration disturbances. Some people have headaches. Okay. They're not able to focus, and they get really worried, oh, if I try to quit, I won't be able to function at work, or this will get in the way of my relationships. Okay.
Now, is that difficulty in focusing because they're just thinking about because their body's craving a cigarette, and they can't get away from that thought, or is it something else?
Well, it's a form of nicotine withdrawal, and the cells in the brain get used to high levels of nicotine. Okay. And if they don't use any nicotine replacement medications we'll talk about soon, it's really hard to focus and hard to be successful in fighting the urges. Okay.
So having an understanding, and I'm sure you'll get into this, but before someone quits, having an understanding of what some of those symptoms might be and how to manage those would probably make for a more successful outcome.
Right,
Is that safe to
understanding
assume?
that it's normal and you need to address them, but also treat them to be successful.
Right.
Willpower alone is not enough for the
Right.
vast majority of addicted smokers.
Okay. Now, that talks about some of the biological aspects, the psychosocial aspects. What are some of the issues that arise for people in particular with those aspects when they're trying to quit?
Well, psychosocial aspects, as I said, involve more the habit component. And
Okay.
a big part of the counseling is a combination of what we call kind of cognitive behavioral or a client-centered form of counseling. And what that is that it helps people to disrupt the associations, the patterns of I want to smoke when I'm in the car, I want to smoke when I'm on the phone, I want to smoke after a meal. All those patterns get really entrenched, and you need to work on steps to break up those patterns to be successful in quitting.
Right. And everyone has those sorts of routines, don't we? This is just how we do things, and I think we don't realize how entrenched they are. As you say, that you really do have to give special attention to try to change those habits.
Right, it's different smokes for different folks. For some people, it might be in response to negative emotion. I need to cope with boredom or worry without lighting up. And we, at the Quitcenter, we look at the person's individual triggers, and we develop a plan to manage them without tobacco.
Excellent. Now, so in those areas, you're really talking about counseling and things, but some of the withdrawal symptoms that you mentioned earlier, you talked about medications perhaps having a role for people.
Right.
How does that help? What do they address, and what are they about?
Well, in almost every case with a moderately or highly addicted smoker, 10 cigarettes a day, 20 cigarettes a day, more, or a menthol smoker, the current guidelines recommend to use the medications. And the medications all work pretty similarly with some differences, but mainly reducing craving. So, for example, someone said, when I tried quitting without the patch, I had a 15-minute craving. Quitting with the patch the craving only lasted 30 seconds. So all the medications reduced those withdrawal symptoms. So there'll be, on average, less depression, less anxiety, less restlessness, less irritability. Someone called it going, rather than crashing cold turkey, it was a soft landing using the counseling, the patch, and the nicotine lozenge.
Okay, so you can use a combination of medications in some cases.
Yeah, and I'll go over all the medications, but some of the latest research, really there's an explosion of research in the last 12 years. A lot of our highly addicted smokers will need to use 2 medicines. We don't recommend that if they're not in a supervised program. But about 50% of our successful clients have used at least 2. And
well, you can talk about them now, sure. What are some of the things?
So there's basically 2 classes of medications. The nicotine replacement products, and 3 of them are over-the-counter. The nicotine patch comes in different dosages. The nicotine lozenges come in 2 dosages, and there's 3 different flavors. Nicotine gum comes in 2 dosages. I think about 6 or 7 different flavors now. And then there's
that's a lot of options. There's a lot of variation there.
Yeah, and that's just over-the-counter. The other 2 nicotine replacements are the nasal spray, and we also, we have this, which is the Nicotrol inhaler, which is a plastic device, and there's nicotine absorbed in, and it helps with the tactile and sensory aspects of it without the carbon monoxide and the other